ladies and gentlemen, fellow Kenyans, I am informed that there are people transporting, even in matatus, into and out of the city. And once they get to a roadblock, they pay and come round the roadblock and walk and are taken again by an empty vehicle or otherwise. In other words, transporters are organizing themselves to pick at each point where there is a roadblock. I am also informed that there are individuals who now have decided that if you come from Nairobi and they know that you came from Nairobi, then they call the authorities and let them know instantly. I want to applaud those people. I want to say that if we all participated, if you inform the police, when you know that there is a person who is not supposed to be there, who is there, then we will handle this disease better. I am not trying to incite Kenyans against each other, but I am trying to say that information about a person who you know very well was in Kisumu or Nyeri or Mombasa, and you know that they are now in Nairobi and they are not supposed to be here, please inform the police, inform the authorities, because that person may very well be your killer. Fellow Kenyans, this is not a time for cat and mouse games. And going forward, what the people who are modeling for us are telling us is that depending on the level of discipline, that the results for this country, the number of people who will die in this country, or the number of people who will not die in this country, will depend purely on the level of discipline that we exhibit going forward. There are models that say that we could lose as many as 28,000 Kenyans dead as a result of this disease, unless we start observing certain measures and ensuring that we do social distancing and every other measure that we have been told. So, fellow Kenyans, Kenya is on red alert. The numbers are rising steadily. In the last 24 hours, we have doubled our testing capacity to test 1,115 samples. Out of these, 16 have tested positive for the coronavirus disease. We are now 262, the number of confirmed cases in our country. By now, you'll have noticed that the higher the samples, the higher the number of cases. This speaks both to the urgency to test Kenyans in the targeted areas I have said, and for every Kenyan to assume that the person next to you is a contact who could be carrying the disease. 15 of these cases who have tested positive are Kenyans and 1 is a foreigner. 12 male and 4 female. None of those has a history of travel, and none of those cases are in our quarantine centers. 9 from Nairobi, 5 from Mombasa, and as I said, 1 from Homa Bay County, aged between 23 and 84 years old. And I can also add here that the 84 years old was a person who also believed in treating people via herbal medicines.